Hi everyone, Dr. Jeff here from Ear Care Specialists in Nottingham. Thanks for joining me. This patient had got their earwax stuck against their eardrum, having unfortunately used a cotton bud in their ear, so they were quick to regret this one. And as we had a look in the ear, we see the wax there. This is very deep down. Just switched the magnification level, but this wax is actually on the eardrum, and it was a little bit tricky because the ear canal was quite narrow. But nevertheless, we give it an attempt to remove the wax. So we go in with the microsuction and we start working on it. Now, initially, I thought we were going to be able to take this out because the wax plug was moving around a little bit. However, unfortunately, we later come to learn that it was really stuck in there. So we give it a bit of a wiggle, but unfortunately, it's not coming out. The patient was very well tolerant of this. They weren't reporting any pain or discomfort, so they were particularly brave, but we again have to be very mindful of patients' comfort levels as well as actually the noise levels in the ear. So remember, with microsuction, it is quite a noisy procedure and we're close to the eardrum, so we have to be really careful and bear that in mind. I've just applied some oil drops there in the appointment, so you can see it's a bit more oily. I've waited a couple of minutes or so, and then we go back in for another bash. And unfortunately, as we go into the ear and have another go, again, it just doesn't seem to make much of a difference within the appointment at this stage. So you can see it just moving around a little bit there, but unfortunately it's not going anywhere. So eventually I will give up and we abandon the ship, and I will ask the patient to use some oil drops every single day, and they do that, I think, for about 4 days. So you just see a glimmer of the wax there, but really deep in the ear canal, just against the eardrum. So having our final attempt before abandoning. It's interesting because often patients, particularly if they're tolerating of it, they'll sometimes want you to persevere and to keep going, but it's important to just bear in mind that, as I say, it's quite a noisy procedure and it can quickly start to get uncomfortable, particularly when working deep down in the ear canal. So in a moment we just decide to give up, and I'll instruct the patient to go away and use those oil drops. So again, slightly closer image there. This is at 12.5 times magnification. So 4 days later then, the oil drops have been used every single day, morning and evening. And when we go back in, the ear looks slightly different now. So the oil has been working its magic and the earwax has been softened ever so slightly. The oil is great at getting in behind the wax as well, so that's the other idea here. It can be used as a lubricant. It can help to just detach the wax from the eardrum in this particular case. So I'm feeling a bit more hopeful this time. We go back in with the suction, and again straight away you get the sort of feedback from the suction probe as it hits the wax, and just with experience I could already tell that this time it was very likely to come out, much to the patient's relief. So we're just giving it a little wiggle and a pull, and very carefully it just comes free. And as soon as it detaches there, the patient was a big sigh of relief. And here it is, out it comes. This is pretty large for a small ear canal, right against the eardrum. Thanks for watching.